Okay, we have Premier John Horgan and Minister of Indigenous Relations and Reconciliation Scott Fraser to give us an update on COVID-19.
Bon après-midi. I'm Danielle Bain-Smith. I'm Echodene from Fort Nelson First Nation, and I'm French-Canadian and Métis from the Red River Valley in Manitoba. I'm extremely grateful to be speaking to you today from the territories of the Lekwungen peoples. Our people have been healthy, balanced, and well for thousands of years. Since contact, we've shown our strength and resilience time and again against deliberate attacks on our ways of knowing and being, our culture, our language, the things that make us distinctly Indigenous. And we have faced ongoing systemic and structural racism and discrimination. As a result of colonial practices and policies, we come into this epidemic on unequal footing. An ethicist colleague of mine noted that coronavirus doesn't discriminate, but systems can and do. I believe that COVID-19 and our collective responses have the potential to promote equity rather than disparity if we come together with one heart and one mind with diverse Indigenous peoples. The work described here today is an excellent step in that direction. Earlier detection of cases with newer, faster testing and informed choices about access to higher levels of care will help decrease the impact of COVID-19, which, as noted by Minister Fraser, has the potential to be culturally devastating. Elders are the heartbeat of our community. They're our link to our ancestors, our teachings, and we need them to ensure cultural continuity. In addition to this great work, there are 3 other considerations that must be hardwired into our responses if we want to achieve equity. The first is that we must use distinctions-based approaches that honor the unique and diverse experiences amongst Indigenous peoples. Recognizing that First Nations, Métis, those living in rural, remote, and urban areas are different from each other and bring different perspectives and needs. Secondly, we need to hear and respond to the stories and needs of Indigenous women and girls, who we know, as a result of the Missing and Murdered Indigenous Women Girls Report, face higher rates of violence, which have only intensified during this stressful time of self-isolation. And finally, we need to use robust tracking using both Western and Indigenous data to illuminate whether COVID-19 responses are meeting the needs of Indigenous peoples in culturally safe ways. By this, I mean it's not just about the services we deliver, it's about how we deliver them. As healthcare providers, we need to be aware and respectful of the uniqueness of BC's diverse Indigenous people. Cultural identity is fundamental to our health and wellness, and it must be respected. In collaboration with First Nations Health Authority, Métis Nation BC, and BC Association of Aboriginal Friendship Centres, and others, our office is working to uphold Indigenous data governance principles and help create a clear picture of how COVID-19 is impacting Indigenous peoples in BC. I've been truly awestruck by the collaboration and relationship building that's taken place over the last number of weeks. During this unprecedented time, there are unprecedented opportunities to advance reconciliation and Indigenous self-determination. I'm hopeful
I'd like to start by acknowledging that I'm privileged to be presenting on the traditional, ancestral, and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. I'm delighted to be part of this announcement today. For the work we are announcing, 19 or other life-threatening situations, that minutes count. And not just for our patients, but for our care providers themselves, who understand that the positive impact they might have on someone's life often increases the sooner the patient's transportation can be merged with the care at hand. As we've heard, we are managing in a new reality in the midst of COVID-19, and this has sparked forward momentum on much-needed transportation resources that will serve our patients both short and long term. As Premier Horgan has already shared, today's announcement involves a number of tangible service improvements for British Columbians living in rural and remote communities. With respect to BC Emergency Health Services, this involves significant additional resources for our transport fleet. including 55 additional ground ambulances across the province. And to highlight, 5 of those will be put into the Northern Health Authority, and 5 additional provincial air resources, both fixed wing and rotary, with others as we need. Initially, this expanded network was activated as part of the COVID-19 surge planning, enabling and supporting the swift connection of people living in rural and remote to higher levels of care. But thanks to thoughtful, evidence-based planning with partners across the province, these resources will remain in place long-term, ready for repositioning as required to meet local needs. PHSA and BCEHS are excited to be working as part of this partnership with the BC government, with our regional health authorities, with the First Nations health authorities, and our Indigenous leaders across the province. As we shift from surge service delivery to implementation of long-term resources, we are actively moving on the next steps. This includes continued engagement and collaboration with the health authorities, First Nation health authorities, and our other Indigenous partners. Human resource planning and implementation is critical, as is engagement with our union partner QP 873 as a key component of this. Our team is truly excited at what this announcement means for rural and remote communities, our patients and families, and our paramedics. In closing, I'm mindful of a well-known African proverb that rings true today. If you want to go fast, go alone. If you want to go far, go together. Arguably, we are also moving fast in light of COVID-19, but the partnership behind today's announcement means our expansion of BCEHS services will be impactful and lasting. Finally, I'd like to thank the government, the Ministry of Health, for your leadership on this. And I would also like to offer my sincere appreciation to everyone who's been involved and look forward to working together. Thank you.
Thank you, Susan. Before we go to Q&A, just a couple reminders. If you want to queue up for a question, please hit *1 now. For those who have already queued up, please unmute your phone. You will not be heard until we open your line. To start, we are going to John Crawford with CFTK. John, your line is now open.
Yes, thank you very much. One of the questions I have is with regards to mental health services, and I'm wondering if that's kind of involved in what we are announcing today. You know, as you know, with First Nations, social gatherings are very, very important, whether it's funeral feasts or, that kind of thing. And obviously during this situation, we're not allowed to do that, or First Nations are not allowed to do that, or discouraged from that. So, which could lead to things like domestic problems and others. So are mental health services also being included in this, and is there a go forward on that as well, perhaps in the long term?
Thank you for the question and some very good points. Firstly, just on the traditions of large gatherings, whether it's to celebrate new life or to celebrate the passing of a life. These are profound parts of Indigenous life and culture, and they have been transformed because of the situation we find ourselves in. That leads to a whole host of challenges. Dr. Bain Smith talked about the importance of I've had the honor to be Premier, has been an extraordinary impact on the well-being, the emotional and psychological well-being of British Columbians. And so we're always mindful of the mental health challenges that people are facing. There's a better understanding broadly across communities about that. Stigma is being reduced all the time, and that provides opportunity. As Dr. Bain Smith said, there's always opportunity to improve, and we'll do what we can particularly when it comes to delivering mental health services in rural and remote communities, but it's not confined to just those areas. Mental health is a challenge for all of us right now, and we're mindful of that. Judy Darcy is very mindful of that, and we're working across government, as we've said from the beginning, to find ways to promote program delivery across ministries, across the province.
Thank you. Next.
States, and I'll take my direction from Governor Inslee rather than the federal government. In the U.S. Guidance, they're not direction. Thank you for the question. Well, we've seen an 83% decline in ridership over the past number of weeks with respect to TransLink, a 75% reduction in ridership for BC Transit in Victoria and Nanaimo and Kelowna, Prince George, and other BC Transit communities, and a 91% reduction in passengers on BC ferries. These very important transport links within BC, public entities, all of them in one variation or another, are in crisis right now. And I raised last week with the Prime Minister and other premiers the need to make sure that when we're looking at wage subsidy programs for the private sector, as we've done with airlines, for example, private sector companies, we should also look at our public entities who depend on a fare box or a direct subsidy from taxpayers, either at the provincial order or the municipal order. We can't sustain an 83% reduction in ridership. That's just not going to work. So we need a national response to our transit challenges as well. Whether you're in Calgary or Toronto or Montreal or Vancouver or anywhere else where there's public transit being delivered, this is a national interest. I tried to raise that in the federal provincial meeting, and I look forward to a response from the federal government in short order. But we need to work on this together. You've heard already mayors from the Mayor's Council and those that are on the TransLink board expressing their frustration at the absence of resources. But, there are absent resources in every sector of our budget, in every corner of British Columbia, and we need to be mindful of that as we collectively come out from underneath this. And that's where our federation, I believe, has an important role to play, and I've made that clear to the Prime Minister.
Next we have Tanya Fletcher, CBC. Tanya, go ahead.
Thank you. Hi, Premier. We've now heard of cases in remote areas like Alert Bay. So is the timing of today's announcement due to more immediate concerns about rural clusters, especially since, those first modeling projections show that one of the biggest threats would be a possible outbreak in rural places that may not be as well equipped? And just kind of a sidebar to that on the threat of protecting the most vulnerable, hearing concerns from the downtown
remote and Indigenous communities that if they need these initiatives and working collaboratively across the regional various health authorities and with communities. When it
or homeless population there that tested positive but did not show symptoms. Are there any concerns that there could be something similar happening in the downtown east side or other communities here in British Columbia?
Thanks, Richard. Firstly, on to broadband, don't have access to Wi-Fi, don't have access to technologies. We're doing everything we can to give those students the tools they need so that virtual learning can be a success for them as well. And I don't want to get in the way of the work that's being done in the sector. Again, a level of collaboration and cooperation that's quite unprecedented in my adult life, to see all of the stakeholders in the K-12 system working hand in hand for best outcomes for kids. This is what we all hope for, and this is what everyone in the